should receive dash antibiotic. Dash is a serious complication of pneumonia that involves pus collection in pleural space. A patient with pneumonia who has persistent hypoxia may require admission to the dash. Patients with severe pneumonia should receive intravenous antibiotic. Dash is a serious complication of pneumonia that involves pus collection in pleural space. Empyema is a serious complication of pneumonia that involves pus collection in the pleural space. A patient with pneumonia who has persistent hypoxia may require admission to intensive care unit. Dash is a laboratory marker used to guide antibiotic therapy in pneumonia. 21. Dash is the imaging test used to confirm pneumonia. 23. Dash is a fungal cause of pneumonia seen in immunocompromised patients. Dash should be administered to maintain SaO2 greater than or equal to 94%. Dash is C-reactive protein. It's a laboratory marker used to guide antibiotic therapy in pneumonia. 21. Dash, which is chest X-ray, is the imaging test used to confirm pneumonia. 23. Is missing here, so let's leave that out. 23. Pneumocystic jirovecin is a fungal cause of pneumonia seen in immunocompromised patients. Who can guess the question of 22? Don't worry, I'll tell you at the end of the MCQ if you can guess the question. Dash is a fungal cause of pneumonia in immunocompromised patients. That's pneumocystis jirovecin. Dash should be administered to maintain SaO2 greater than or equal to 94%. Oxygen should be administered to maintain saturated oxygen greater than or equal to 94%. 25. The pneumonia severity scoring system is called dash. 26. Finding a bronchial breathing on auscultation suggests dash. 27. Dash is a sign of severe pneumonia when partial pressure of oxygen is less than 8 kilopascal. 28. Patients with pneumonia and persistent fever should have repeat dash. 25. The pneumonia scoring system, severity scoring system is called COB-65. 26. A finding of bronchial breathing on auscultation suggests dash consolidation. Dash is a sign of pneumonia with partial pressure of oxygen less than 8 kilopascal. Respiratory failure is a sign of severe pneumonia with partial pressure of oxygen less than 8 kilopascal. Patients with pneumonia and persistent fever should have repeat chest X-ray. Still coming back to 22. Try and guess the question. Dash is a bacterial cause of pneumonia associated with aspiration. A patient with pneumonia who is confused should have an dash mental test score less than or equal to 8. A 70-year-old man presents with fever, dyspnea, with purulent sputum, pleuritic chest pain. His respiratory rate is 32 cycles per minute, blood pressure 85/55 millimeters of mercury, urea is 8.5 millimole per liter. What is his COP65 score and what treatment setting is appropriate? Anaerobe 29. Anaerobe is a bacterial cause of pneumonia associated with aspiration. 30. A patient with pneumonia who is confused should have a abbreviate mental test score less than or equal to 8. Abbreviate, appropriate mental test score, all the same. A 70-year-old man again presents with fever, dyspnea, cough with purulent sputum, pleuritic chest pain. Respiratory rate 32 cycles per minute, blood pressure 85/55 millimeters of mercury, urea 8.5 millimole per liter. What is a COP65 score and what treatment setting is appropriate? His COP65 score is what? 4. Number 1, C is what? Confusion. He's not confused. Urea, his urea is increased. It is 8.5 millimole per liter. His respiratory rate is increased. It is greater than 30. It is 32 cycles per minute. His blood pressure is less than 90/60. It is what? 85/55 millimeters of mercury. And his age is 77, which is greater than 65 years. So it is called 4. It requires an intensive care unit admission. 32. A 45-year-old woman with pneumonia has a partial pressure of oxygen of 7.5 kilopascal and saturated oxygen of 90%. What does this indicate? A 30-year-old man presents with dry cough, fever, malaise, and no sputum. Chest X-ray shows diffuse interstitial infiltrate. What is the likely causative organism? A 60-year-old man was admitted 3 days ago for surgery and now has fever, cough, purulent sputum, and tachypnea. What type of pneumonia is likely? 35. A patient with pneumonia is not improving despite antibiotic. Repeat chest X-ray shows pleural effusion. What is the next step? Let's go to 32 answer. I guess you have all the answer. A 45-year-old woman with pneumonia has partial pressure of oxygen of 7.5 kilopascal and SaO2 of 90%. What does this indicate? Severe pneumonia. The partial pressure of oxygen is less than 8 kilopascal and saturated oxygen is less than 92%. She needs oxygen therapy. You see what is here? 7.5 kilopascal, 90% is already indicating that the patient needs oxygen. Mycoplasma pneumonia is the answer to 33, which we said a 30-year-old male presents with dry cough, fever, malaise, and no sputum. Chest X-ray shows diffuse interstitial infiltrate. What is a causative organism? Mycoplasma pneumonia. They don't come with sputum production, and they have dry cough, and their chest infiltrate to be diffuse interstitial infiltrates. So the causative organism is Mycoplasma pneumonia. 34 is hospital-acquired pneumonia when onset is greater than 48 hours after admission. Let's go through the question. A 60-year-old man was admitted 3 days ago for surgery and now has fever, cough, purulent sputum, and tachypnea. What type of pneumonia is likely? And that is hospital-acquired pneumonia, onset greater than 48 hours after admission. 35 is perform a pleural fluid aspiration to check for empyema. The patient in 35 presents with pneumonia that is not improving despite antibiotic, and a repeat chest X-ray shows pleural effusion. What is the next step? And that is what we said, that we have to perform a pleural fluid aspiration to check for empyema. So back to question 22. I asked you to guess the question. So question 22 is Legionella pneumonia can be diagnosed by testing dash for its antigen urine. All right, thank you very much for joining me in this question and answer section of the topic we just discussed, and we are going to go to the next topic. Please like my channel, subscribe to my